So this is our presentation of Gerascophobia. I'm Alex.
I'm Kaylee.
I'm Micah.
I'm Shania.
I'm Jaden.
So what is Gerascophobia? It's a irrational, persistent fear of aging or growing old. People with this phobia experience high anxiety or distress at the thought of aging. This fear can affect daily life, relationships, and mental well-being. Cases vary in strength from affecting life to being a fear in their mind to changing, affecting every single aspect of their life. The origin of phobias is multifactorial. It is caused by interaction between biological, psychological, and social/environmental factors.
So here's some other symptoms and diagnostic criteria for the disease. It's a sense of dread at the thought of aging, and it kind of leads them to avoid situations regarding the passage of time. It often extends beyond physical changes and talks about concerns of mortality, loss of independence, and even unknowns of the future. Interplay between pre-existing conditions can contribute to the development of Gerascophobia, and these conditions can also heighten the symptoms after the development of the phobia. So into the diagnostic criteria, a new scale is created, and the test is called the Gerascophobia or Excessive Fear of Aging Scale, the GFAS. The distinction of the GFAS is that it's not only brief, but it's also very simple to use, requires little time to fill out, and is suitable for both men and women and may be administered to people of any age. So these tests should be interpreted by mental health professionals as well as any symptoms or signs that aren't on the test as previously listed.
And then understanding the fear of aging, physical changes, those could be fear of wrinkles, weakness or illness, loss of independence, worries about relying on others, societal pressure. Society often glorifies youth, making aging seem negative, and mortality awareness, fear of death, or the unknown.
So now I'm going to discuss the outcomes before treatment. So then there's the negative body image, where individuals with Gerascophobia are overly concerned with their appearance, which this leads to body dysmorphia, which is a constant focus on the individual's so-called flaws, leading to the development of constant dissatisfaction with their appearance. So we studied a case where a little boy was severely underweight and wouldn't eat due to this phobia. After treatment, he recovered over 6 kilograms of weight. Then we have the avoidance stages, which is basically where some individuals with this phobia might avoid major life milestones like pursuing a specific career, getting married, or even starting a family, or making long-term plans due to the association of these accomplishments with aging, ultimately causing self-sabotage. Then we have physical health neglect with this phobia. It can lead to avoidance of seeking health care, especially when it involves change in the body, such as muscle loss, vision, or hearing changes, and then other issues related to normal aging of the body. And then the low quality of life. This is due to the fear of aging, and then it becomes difficult for someone to enjoy the present time because they're so hyper-focused on the future and what aging will look like for them. This also contributes to diminished sense of well-being and a lower quality of life. It also correlates with our case study. Because the boy had low self-esteem and due to being worked up or focused on aging, he was bullied at a young age. And these were things that he couldn't control, making him not want to grow up or making his phobia even worse.
So some treatments for Gerascophobia. Exposure therapy is a type of cognitive behavioral therapy that puts the person in a situation where they experience their phobia and stay in it for increasing amounts of time. Another technique used is MBT, also known as mentalization-based therapy, which is a psychotherapeutic approach which focuses on improving one's recognition and regularization of their own mental state. This is different from CBT, but they can be used in unison. They both come from the same framework. As we look at our Gerascophobia case study, the 14-year-old boy was suffering from it. And he was admitted to undergo exposure therapy, being exposed to his feared stimuli as well as relaxation techniques. However, this did not work, and he was admitted to an institution where he underwent different psychotherapy, like using the crisis intervention model, bringing them to mentalization techniques, which allowed him to better understand emotions and why they may not be so obvious. And he was then introduced to fluoxetine, which is an MMRI or antidepressant, which started at 20 milligrams a day and then it was increased to 40 milligrams a day after 6 weeks. Some feelings did persist, such as the fear of commitment and the responsibilities asked of him as an adult, but overall the symptoms improved and yielded promising results and allowed him to gain his weight back, lessen his anxiety and depression, allowed him to think about the future and growing up without worry.
So outcomes after the treatment. So increased social engagement. So fear and avoidance begins to decrease. The individual will begin to engage in social situations, even including the ones that involve older people or topics of aging. So he attends school and has good performance. He has friends and participates in extracurricular activities, such as his English classes. And then better healthcare practices. So as we treat individuals, we learn what effects different treatments have, and this allows us to better help those who suffer from phobias. So with healthcare practices too, it includes better eating and having positive outlooks on the future, leading to better standard of health overall. And that's our references.
All right.